Last summer, Missouri voters approved Medicaid expansion, but 8 months later, and lawmakers still haven't passed the funding for it.
And this week, a proposal with bipartisan support failed. Our reporter Sarah Blake shows us how this impacts those who need health coverage.
Casey Care Health Clinic and other advocates for Medicaid say these delays could spell out a dire future for the people they serve, not only here in the city, but out in rural areas as well.
The majority of Casey Care Health Clinic's patients are uninsured or have Medicaid. Many of them would be newly eligible for Medicaid under the expansion amendment Missouri voters approved in 2020.
If you look at the states around Missouri that have expanded Medicaid, access has gone up tremendously. It creates an opportunity for people to be more prevention focused and long-term health outcomes.
By law, clinics like Casey Care are required to start enrolling people in Medicaid on July 1st. Medicaid expansion will open up health care access to 275,000 people in Missouri, including single adults who didn't qualify before. Problem is, lawmakers still haven't enacted the rollout. The Senate Appropriations Committee on Wednesday voted down a proposal to make room for it in Missouri's budget.
It's a delay in their access to health care. It's a delay in our access to the federal dollars that are going to provide, $2 billion to our state in 1 year alone. That goes to new jobs.
Democrats like Representative Peter Meredith say this isn't a financial blow to the state, but GOP lawmakers like Senator Denny Hoskins says it's not fiscally responsible to, quote, put able-bodied adults on Medicaid expansion.
These dollars that we are getting from Biden bucks will not be available forever. And so when you expand Medicaid, and I believe the proposal in Missouri was about $60 million of general revenue that would be used, that will continue to increase over time.
Hoskins argues the expansion amendment doesn't have a funding mechanism, but the federal government would give the state a little over $1 billion to pay for Medicaid expansion. The state also gets another $1 billion from a federal aid relief bill to use in any way.
And this is something that I campaigned on, that I was against expanding Medicaid. And so I feel like I'm just living up to my campaign promise, as well as what the voters in my district overwhelmingly decided.
If lawmakers don't act by July 1st, lawsuits are almost guaranteed.
How much kicking and screaming we do and how many people have to suffer along the way depends on what the Senate and the House decide to do here in the legislature, and then what the governor decides to do in responding to that.
Sarah Blake, 41 Action News.